Hello, is that Christine Smith?
It is.
Hi, I'm Dr. Pillon calling from the health centre.
Oh, hi, doctor.
Hi, can I just check your date of birth to make sure I've got the right person?
Yes, it's the 7th of the 4th, 1965.
Oh, fantastic. It sounds like
Yeah.
you've got some other people with you there. Are you okay to talk?
Yes, I'm fine.
Right, okay. So how can I help today?
So basically what it is, I was just ringing up. I've had a bit of like an ulcer on my tongue. It's been
Okay.
there for a couple of weeks, and I was just wondering if I could get some cream or something for it.
Oh, okay. Have you had ulcers on your tongue before?
Not many. I sometimes get a few, if I'm a bit run down, things like that. But
Right. Okay.
yeah, this one's just been there for a couple of weeks and hasn't really been settling, so I thought it might need some cream and if I need antibiotics.
Okay.
So I thought I'd just give you a ring.
Yeah, and so have you had one that's not gone away with things before? Or is this one just
Have I
stayed?
what, sorry?
So have you had an ulcer that's not gone away before?
Uh, no, not really, no. They
Okay.
normally just settle down. I just wondered if
Yeah.
it might be something different.
Okay. And is there a cream you've used before that's worked quite well?
No,
No.
no.
Okay. Um, I just wonder, do you think it'd be possible for you to send me a picture of the what you've got on your tongue so I could look at it?
Yeah, how do I do that?
So if I'll send you a text message, then you can take a
Yes,
picture and then you send that back to me.
yeah,
Should we
yes,
do that?
that's absolutely fine.
Right, should we just do that now and I'll send you that message through?
Yeah, that's fine.
So that's going to come through. So I think you should have got the message now.
Yeah, so
And if you just take a picture and send that back to me, and I'll have a look at it.
yeah, will do. Okay. And then are you
Okay.
going to ring me back?
Odd. If I keep you online, sometimes it's quicker than you think. This system. Sometimes it's slow.
Okay.
We'll just see
Right,
if
I'll,
we'll see if it appears up. Okay.
okay, I'll take the picture. All right.
Wonderful. Okay. Yeah.
Right. Does that
Okay.
work?
Oh yeah. There, it's come through there. Fantastic. Right. So I'm looking at
Yeah.
that picture now. So it's like kind of like a white spot about a centimetre on the
Yeah.
side of your tongue. I mean, it's quite.
Yeah.
Is it quite sore that?
A little bit sore. Yeah, it's been a little bit sore.
Okay.
Not.
Has it
Yeah.
has it bled at all?
No. No.
Okay. Um, and I suppose I want to ask some more questions about your mouth and dental health, if that's okay. Do you
No,
have,
that's fine.
yes, you don't have any dental problems, or do you wear dentures?
No. No.
No?
No.
Okay.
No.
Um, and are you generally well otherwise?
Yeah, I've got diabetes,
Yeah.
but generally that's fine.
I mean, I've probably got
Yeah.
it on my screen somewhere, but you might know quicker. Is your diabetes quite well controlled?
Yes, I'm just on metformin for that.
Oh, perfect. Okay, good stuff.
Yeah.
Right. Okay. I mean, right. Looking at that lesion on your
Yeah.
tongue,
Yeah.
I don't know that it is an ulcer.
Oh, right.
It just doesn't quite look like them. I know when you've had them before, they're often quite small, red
Yeah.
looking lesions, and that just doesn't look quite right to me.
Okay.
The other thing about it is, I suppose you've had it for quite some time.
Yeah.
Um, like you've said, when you've had them before, they come and go quite quickly, and that one hasn't done that.
Yeah.
I think sort of really is part of that. I would want a specialist to take a look at it and see whether that's something more serious, actually.
So what do you mean? Go to the hospital or something like that?
Yeah, so my feeling would
Yeah.
be is that we would get you seen by, they're called oral and maxillofacial surgeons. They specialise in the mouth and face.
Right. Yeah.
I think
I don't really want to go to the hospital at the minute though. With this coronavirus, that I really just don't want to go to the hospital. I think I just want some cream. You can just give me some cream, and then, I don't want to go up there.
okay. I think a lot of people are having that worry at the moment, aren't they? Because we're
Mm.
all trying to avoid seeing people if we can avoid it. And I think that's a very sensible place to be, really.
Yeah.
I suppose my concern is that from what I can see in the picture, there's a possibility that what's on your tongue could potentially be a cancer, say.
Oh. Oh.
And and that's my concern, is because if we're in the first few weeks, you've only had this for 2-3 weeks now, I'd
Mm.
rather we get that seen earlier than later. Now, it might not be. There are some other things that can cause problems with the tongue and mouth that are easily and simply treated, but I suppose I don't want to miss that really big and important thing. Um, so,
Okay.
so I think it's important that you know that, because I think we have to
Yeah.
decide what to do. And
Mm.
I guess in me saying that, does that change your mind about going to hospital, or are you still quite worried about it?
I mean, I mean, I think obviously if you think that, then that's fine. I mean, I'll go and get that looked at then. You know, I
Okay.
thought it was just an ulcer, and you know, I didn't want to go to hospital, but I
Yeah.
suppose that's okay.
I suppose to be fair to you, I should sort of, I think an option could be we could
Yeah,
try the standard treatment for an ulcer, see what
yeah.
happens over a week, and if it doesn't get better, then refer. I suppose that's an option. But
No, it's
yeah,
fine. I'm happy to go up to the hospital. Yeah, that's okay then. If
I have to say I'm pleased you've said that
yeah,
because I do think that's
yeah.
probably the right option to do.
Okay,
So what I'm going to do is I'm going to do a referral to the hospital, and they are running clinics as usual for this kind of thing. So you'll be seen within the next 2 weeks.
okay,
Now, sometimes what they might do, rather than see you, is do what we've done today: is speak to you on the phone and maybe ask you to send a picture in.
okay,
But if they're still running as they normally do, and if you do need to go to the hospital, I suppose to try and be rest assured that they are trying to do things as safely as possible there. So these clinics are actually being held in different locations from the wards.
okay,
They're seeing people in sort of spaced out waiting rooms and wearing protective equipment, so to really try and minimise your risk of things.
okay.
I suppose
Right.
the other question I suppose I would have is that how would you get to the hospital? Could someone in your household take you there, for example?
Yeah. Yes, they can. I can get my husband to take me. That's
Good.
fine.
So that then
Yeah.
eliminates the worry about using a taxi or public transport. So that's a good thing for us to do there.
Yeah.
So,
Yeah, that's fine.
as I say, the referral I will do, they will contact you after that. And I think I just want to be really clear. I hate to be sort of too miserable about these things,
Mm.
but I send you to the clinic in case it's a cancer, but it doesn't mean
Yeah.
I definitely think it is. So
Right.
I don't
Okay.
want you to worry too much. I want you to be pleased that you've rung us early on when the things don't seem right so that we can check things over properly.
Okay.
Okay.
That's fine. Yeah.
Have you got any questions about what we're going to do there?
No, that's fine. 'Cause you said someone will contact me and let me know where it's going to
Yes.
be.
Yes, so I do the referral, then someone from the hospital contacts you with when the appointment, when and where it's going to be.
Okay, that's
Okay.
fine.
All right.
Yes, that's great. Thank you, Doctor.
Okay. If something
Okay.
else happens before then and you're worried about it or you want to ask more questions, because I know I've talked an awful lot today, please give us a ring back and I'll try and get back to you to answer anything you might want to ask.
Okay. Yeah, that's
Okay.
great.
All right.
Very much.
Thanks very much.
Thank you.
Thank you.
Bye.
Cheers. Bye bye.